I wanted to have kids, and you said that you wanted me to have a vasectomy when you said that you might want to have kids, and I wasn't so sure who had the vasectomy reversed. Snip, snap, snip, snap, snip, snap.
Honestly, the funny part about it is that most men come in shortly after their most recent kid is born, right? They're like, okay, this is kid number 2, kid number 3. I'm not sleeping. I'm exhausted. Like, I don't want any more kids. And usually they've had a conversation with their partner who is on board with that as well. So that's like the most common type of person that comes in. And maybe they have a partner who's on some other form of contraception that might be causing a side effect. There are some men who come in who do not have, are not in a current relationship, do not have children, but are fairly certain that that's not something that they want in the future. I have a conversation with those men too. I don't think that negates their ability to have the procedure done, but I just counsel them to be certain that this is what they want, because we tend to counsel patients to think of it as a permanent form of sterilization. A vasectomy implies that you are cutting the vas deferens, which is the tube that takes the sperm from the epididymis, where they mature after they're made in the testicle, and it delivers the sperm into the ejaculate. When men are interested in sort of sterilizing themselves and are interested in a permanent form of sterilization, they can opt to undergo a vasectomy, which involves cutting that highway and often tying it off and doing everything we can to make sure the highway isn't put back together at some point afterward. It's pretty quick. I would say anywhere from like 20 to 40 minutes. It's done in the office setting in most cases, so it's a pretty easy procedure as they go. Generally speaking, we try to do these, in my office at least, on Fridays, just to allow patients to recover on the weekend, assuming they're not having to work on the weekend. There's not any significant pain in most cases. We don't prescribe pain medications as part of the recovery. I encourage a lot of my patients to use ice, which helps reduce inflammation and swelling, and can often help with any potential discomfort that's experienced after the procedure. It's also really important to have men wear some kind of compressive garment. And if you can manage the inflammation and the swelling, you've won the battle. It is technically reversible, but that's not always the easiest process. And so we don't want people making sort of rash decisions and ultimately regretting having the vasectomy and having to find a way to get it reversed. If they were to opt to reverse it in the future, the process is the exact opposite of what they are going to go through with a vasectomy. A vasectomy reversal is typically done in an operating room. It requires an operating microscope because you're trying to essentially put together two pieces of like a tube the size of a string of pasta. It takes several hours to do, and remember, you have to do both sides. And it's not always guaranteed that it will result in sperm returning to your ejaculate. And it's definitely not guaranteed that after the reversal you'll be able to get somebody pregnant. It doesn't have any detrimental effects on sexual health, assuming that the procedure was straightforward and the recovery was as expected. I do get a lot of patients concerned about that, right? Because you're sort of interfering with their manhood, and so they're concerned that it might have a detrimental effect on their sexual life, but there's no evidence of that. It does not prevent you from passing on sexually transmitted infections or HIV. Again, because the fluid is something that you still make, and you still make the sperm. It's just that the sperm aren't allowed to get into the fluid. So the vasectomy just prevents the ability to get somebody pregnant, but the various infections that we screen people for, including HIV, are transmitted in the semen, which you do still make. There is always a risk of infection anytime you're cutting, into the body, right? Even though it's a tiny, tiny incision, you are breaking the skin, and you could introduce an infection. But the infection risk is so low, it's not standard to put people on antibiotics to prevent infection, which is commonly done with other procedures that have higher risk of infection. A lot of the procedure is done through palpation, till you can feel the vas, and then isolating it from the other structures around it. But because there's lymphatic vessels, there's veins, there's arteries, there's fat, all kind of surrounding it, there is the potential that one of those other structures could be injured. And that's what I was kind of alluding to in terms of like a potential complication. But that's exceedingly rare. So it's in general, of the things that we do in our office, it's probably one of the safest procedures.